So hello, thank you very much for the opportunity of speed dating with you guys. I will tell you something about the PDGF receptor beta targeting, and I have to disclose that we do this in collaboration with Biorion, which is a small pharma that is here based in Groningen. As probably everybody knows here, interferon gamma is one of the major players, both as an antifibrotic, but also as a pro-inflammatory cytokine. And this fact that it is so important as an antifibrotic made the group here in Groningen in 2011 go about making a cyclic peptide. So using a part of the interferon gamma and link it to the PDGF receptor beta and use this cyclic peptide to target the activation of the interferon gamma signaling only on the myofibroblasts and not on the macrophages in order to not have an anti-inflammatory response. So in the past years, we've been working, and when I say we, I mean my very gifted PhD student, Sophia, on setting up a model in which we could culture Dupuytren three-dimensionally, because as you have heard from the also previous speaker, culturing cells is an issue. It's very difficult to reproduce experiments. So what we have done is that we set up a system in which we excise, the plastic surgeon excises the Dupuytren and we section it and place it on nitrocellular membranes that are never in contact with the media. And this can be grown for up to 21 days. And what we do is that we analyze compounds or function analysis on the Dupuytren itself. We can also look at tension in a reverse way from how the previous speaker has shown us, but what we do is that we apply tension and we measure the release of it on the tissue itself. But for the purpose of this talk, what I will show you is that just a few slides in which you can see here how we can measure in time the extracellular matrix. This is second harmonic generation live images of collagen and how the extracellular matrix rearranges based on the addition of the BOT1 compound. We can also look at the immunological markers that come and are modulated in this three-dimensional setting. So the first thing we did, we looked at the levels of the PDGF receptor in our RNA sequencing array database that we have generated, and compared to control tissue, seems to be, as we hoped, enough PDGF receptor. And here on the slide you see just a snapshot of the expression of the PDGF in combination with the smooth muscle actin. Very nicely, the smooth muscle actin is also expressed on the vessels, but the PDGF is not. So makes it very specific for targeting the myofibroblasts. So what we have done is that we have applied the compound, and what you see here is a snapshot of day 3 and day 7. And what you see is that we have a reduction of what we like to call the fibrotic load. And the fibrotic load measured in terms of smooth muscle actin, collagen type 1 and collagen type 3. And we compare it to what we like to call the golden standard, which is pirfenidone, which also seems to have an effect on the extracellular rearrangement. Well, this was it for now, and my thank you goes mostly to Sophia for setting up this beautiful ex vivo model, and Rajiv, which is working on it right now, and of course Peter Kloon, which is the surgeons that provide us with the tissue. Thank you.